Morning, Chris Ohl, Wake Forest School of Medicine, Infectious Diseases. COVID update coming up on the end of February. Made it through Valentine's Day. Hopefully everyone got out to their favorite restaurant. So this is Support Your Local Restaurant Month, and I think it's okay to do so. The bit of a milestone next week for those of us in the room here. And for those of you viewing, it has been 2 years since we started doing COVID updates. Kind of hard to believe. I look back on it and ask myself, would I have predicted in 2 years we'd still be doing these? Well, yes and no. It's the whole pandemic has played itself out a little bit differently than what I thought it would. But generally, the time frame is following what I would have expected at that time. Pandemics take time. All of them in the past have throughout the centuries, and so this one is too. But we are making progress. We're going down the road, and every little hiccup or wave or release of a wave is another tick on the milepost as we go down the pandemic. And as things fade into endemicity, we will start to be feeling better about it all, and we're on that way. So cases here in the triad, good number to remember, 43 per 100,000 per day is what we're at in Forsyth County. Guilford's 41 and Mecklenburg's 44, so we're all running in the 40s. So the counties to the direct west of us here and to the north are a little bit higher, up between 50 and 100, but they have gotten below the 100 mark, which is an important milestone for them. So hospitalizations continue to decline, albeit more slowly than our case rates. But we're starting to get a little bit of relief in our acute care hospitals. Still have quite a few people, though, with COVID in our hospitals, and it's still roughly around 80 to 85% of them are unvaccinated. The remaining percentages are people who have serious underlying health conditions or are immunocompromised. So it's that hasn't changed. We're still having cluster outbreaks in some of our nursing homes in the area, and it's still important for staff to be careful, either getting tested or vaccinated, and so we can protect our most vulnerable, which are our aged. Schools and universities are also doing pretty well. Wake Forest University, if you take a look at their dashboard for the last 2 weeks, 1 to 2 cases per day out of roughly 10,000 students, faculty, and staff. So that's not bad at all. And their success is attributed to being vaccinated and boosted well up over 90% for everybody. And it just slowed viral transmission down, even in congregate areas. Like, if you think about being a virus, where would you want to spread around? You would want to do it in a dorm room or a dorm, and even with that, the cases have been very manageable at Wake Forest. So, applause to the leadership at that university, and to the students, and to the faculty and staff for doing everything they needed to do to embark on a very successful spring semester, despite a huge Omicron surge throughout January. Our other school systems, K through 12, are doing fairly well too. Case numbers are coming down in our schools. Still, kids, the rates are higher than they are in adults, but those numbers are starting to come down as well. And that's all good news for our kids. While on the subject for kids, a little bit of an up and down about vaccination for our kids under the ages of 5 and the research studies about those. So if you remember, back in the first part of January, I said it'll probably be April before we'll have a vaccine for that age group deployed, because we had to go through the studies to figure out dosing intervals and number of doses in order to provide the optimum immunity for kids under 5. So that's 6 months through the age of 4. And then 2-3 weeks ago, there was a splash of news. Oh no, we'll have it in February. We're sending the data. Pfizer was sending their data to the FDA for the EUA, and I said at that time, don't be surprised if it's actually still April. And guess what? Now they're saying back to April again. And I want people to understand that this has nothing to do with safety concerns about the vaccine, because it looks great and the data in that group looked great. But we have to figure out when to provide a third dose to that group. And the studies need to complete out, because you have to go through the weeks to months to get the third dose in, and then you have to analyze it. So that's what's going on right now. So vaccines for 6 months through the age of 4, I would predict the end of April. So when you see the tulips, think vaccine for our little kids. And I think that'll be a significant milestone, because it certainly, that's one group of parents who've been very patient with vaccination. A couple other things on the horizon. Roughly 30 minutes ago, press release went out here in Winston-Salem about our citywide mask mandate. I think most people realize that we've had mandatory mask wearing indoors, at least in public spaces, now for some time, since we're way back in Delta. And so a big milestone for us. We have decided that on March 1 that the mask mandate for Winston-Salem will be rescinded. I think you'll see mask mandates in other areas and drop in about the same time, and we'll talk about that in a minute. So everyone's going to ask me, what do you think about that, Dr. Ohl? And I said, I think it's okay. I mean, the mayor and I talked about it. And I think it's okay for the following reasons. One is our case counts are coming down. At 43 today, we're going down by about 7 a day. So by March 1, we should be in a much more comfortable range for the number of cases being transmitted in the Triad area. Number 2 is that the end of February, first part of March is when our respiratory viral season usually winds down. So influenza, other viruses, paraflu, RSV, all those little nasty bugs that like to make us miserable with coughs and colds tend to start going down roughly at about the same time frame. And the weather warms up. Yes, it will warm up. I've been told by my weather colleagues that it is coming. So people spend more time outdoors rather than indoors. Humidity goes up a bit, temperature goes up a bit, the virus doesn't do as well quite as much in those situations. And then lastly, N95s are ubiquitous now, and people can get them. And I'll tell people what to do with those in a minute. And then we have more treatments coming online. This week, the state cut out a lot of the restrictions on using Storimab, which is one of our monoclonal antibodies that works against Omicron. We have a better supply of it now, so it's more widely available for people with underlying health conditions, including those with diabetes, heart disease, lung disease, kidney disease, as well as immunocompromised patients, cancer patients and such. So we have more treatments available. Paxlovid, the oral treatment's also becoming more available. So as treatments become more available, then we can give effective treatment to people who are at higher risk of having complications of COVID, which reduces the impact of the virus. So lots of reasons that we can drop our mask mandate for indoor spaces. Now, having said that, while the mandate may be dropped, it doesn't mean that wearing a mask at times still might be a good idea. And let's go through a few of those when you still might want to wear a mask. Because masks do work. N95s work very well for personal protection. To show you how well they work, when I see a patient with COVID, I put an N95 on and I can look down on that patient and they can breathe right on me and breathe the virus all over them. And if I have an N95 and I wash my hands and I have something in front of my eyes as well, I don't get COVID. And so if they work for those of us in healthcare actually taking care of COVID patients, they're certainly going to work for you out in the community. KN95s are just as good as long as you don't get a counterfeit one. There's a few of those out on the internet, so you have to be a bit careful. And so a high-grade medical mask could be worn if you are, say, more vulnerable. Let's say you have an immunocompromising condition. You can talk with your doctor if you're on that list or not. If you have other underlying health problems that make you at higher risk of having a complication with COVID, heart disease, lung disease, kidney disease, so on and so forth, had a stroke, those would be people who still might want to wear a mask. And people over the age of 75 might want to wear a mask, particularly when going out in public areas, particularly in areas that are crowded. So I don't think I have to go through a lot of examples about crowded situations, but let's say you're going to your kid's championship basketball game and the bleachers are packed. That's a crowded situation. You may want to wear a mask. Church, Easter Sunday, church is packed, pews are crowded. You might want to wear a mask in that situation. Standing in a long line full of people waiting for down at the DMV, for instance, to get your license removed. You might want to wear a mask. But otherwise, I think it'll be safe to take them indoors after the 1st of March, take them off. So for those who are vulnerable or going into crowded situations where distancing is not possible, I think I'd still wear a mask. I plan on it. Well, does that mean this is permanent? Well, we'll have to wait and see. I don't see any nasty villain variants on the horizon right now that worry me enough to put our maskless state at risk. Does that mean one won't happen in the future? I'm not going to predict that anymore. It's possible. And yes, we could have another surge. When might that happen? Maybe next fall or winter would be one place as respiratory virus season wraps around again. So it could be that the masks will need to come back out. But now with their numbers coming down and we're going to have a nice spot, I think the goal is to try to do and take away restrictions when the numbers are good. When the numbers are bad, we bring them back as if and how we need them. What about schools? So I told you case numbers are coming down in schools, although a little bit slower. Will it be okay to take away the mask mandate in school systems and I'll say throughout the state, because our numbers are all kind of the same, at least in our urban areas. And I would say yes, probably roughly around the same time frame. It would be possible. And for the same reasons that we talked about it for adults, apply also to the schools. Predominantly that transmission will be going down. Respiratory viral season will be wrapping up. And I think our kids will be okay to take the masks off sometime around the same time frame that we're doing it for the city. Some school systems might want to delay a little bit, depending on what their numbers are and what their own situation is. So we'll have to see how that goes. So I do support that. And there are good reasons for kids to not wear masks as well, particularly the youngest kids, where being able to look at the mouth and speech patterns is helpful in early learning. And then for activities that they can do that are easier without a mask on. So I also support that. And so in the next few weeks here, you're going to be seeing a lot less masks, I think. And I'm okay with that. And I think it's safe to do so. Now I want to speak a little bit particularly to the situation in schools. Because one is that public transport, we still need to wear a mask. That's federal law. So if you're on a city bus, you still need to wear a mask. Getting on an airplane, you need to wear a mask. Walking into PTI airports, you still need to wear a mask. School kids will still need to wear a mask on their school buses because that's actually federally regulated public transport. So that would be an exception. The other thing that I want to mention about schools is that there are still people who are anxious about taking the masks off in schools. They're anxious for their child, and they want to protect their child, like all of us parents want to do, is to protect our child from any kind of harm that could potentially come to them. And so there'll be some parents who will still want their children to wear masks in the school, and that's fine. And I think particularly for kids who have some health problems, such as asthma, which is common in kids, and sometimes some other respiratory illnesses, which we see in children. Some kids have other underlying health problems, and they'll still want to wear masks while they're in school. I think as parents, when we talk to our children, that we need to say, you know, even though it's okay for you to take your mask off when you go to school, when that is announced and that time is right, then talk to your kids about understanding that there will be still children who will need to have masks on, either because of health problems or because their parents want that extra degree of protection. Be supportive of that, be understanding of that. And we need to let our kids know that, because certainly we don't want kids who still need to wear a mask or want to wear a mask in school be singled out or made to feel different. It is okay to still wear a mask. So what we're kind of doing with all of this is shifting the responsibility for reducing viral transmission in public areas from that of a large social mandate or a community mandate where we all wear masks all the time, and we're shifting this to a personal choice and responsibility to wear a mask if you want to protect yourself. Because if you wear an N95, you can be surrounded with people who are unmasked and you're okay. You're not going to get COVID in that situation. Surgical masks also work extremely well. Even cloth masks do a pretty good job. Not quite as good as the medical grade mask, but pretty good. So if you're masked up, then even though the people around you are not, you can rest ease and you don't have to be anxious. It's okay. You'll be protected. You'll be fine. And it's 2 years of wearing a mask. It's a little bit tough to kind of get used to the new paradigm, but it's an important stepping stone for us in the path to treating the virus as an endemic virus rather than a pandemic virus. We have a few other stepping stones to go, but this is a biggie, and I support it. So we'll be keeping an eye on things. We'll be keeping an eye on our on transmission in schools. We'll be keeping an eye on our community transmission. We'll be keeping an eye out for any nasty variants that might be on the horizon, because we can always bring these tools back that are effective to reduce viral transmission if we need to. Another word about schools. So there'll be another change in a little bit in how schools do things. I think for most parents this will be kind of transparent, but it is also another significant step to treating the virus as endemic. And that's how we do contact tracing. And so right now in North Carolina, if you are a kid and you get COVID, you'll get a call from a school contact tracer asking who you might have been around at school. And then we contact those people. We call them a contact. And if they're unvaccinated, they have to stay home for 5 days in quarantine until we can see whether or not they turn positive. The change reflects that a child who is identified as being a contact, whether at school or in the home, will still be able to go to school. They don't have to quarantine at home anymore. And that's huge because during January we had hundreds of kids having to sit out in quarantine doing virtual learning and driving their parents nuts, most likely. And they won't have to stay home anymore. They can continue to go to school if they're a contact. But they should get a test sometime between day 3 to 5 to make sure that the contact they had didn't infect them. And that test will be on the child, but also there are, and we now, at least here in Forsyth County, have testing available in every single school in our county. That'll be ramped up, I think, as of next week to include all schools. So that's pretty cool. So if your child gets the sniffles, he can get tested at school. If your child's a contact, he can get tested at school. But you don't have to sit in quarantine anymore. But we'll still be doing some contact tracing. Some school jurisdictions will be doing that for another month yet, just to keep track and see if we have clusters in our school, because as we take the masks off, we want to make sure that we're not having a rebound of cases. So contact tracing will still happen, but you'll be able to go to school. So a lot of parents saying yay, a lot of kids saying, I was hoping I could make a long string bake. But so that's another good stepping stone. A few other loose ends to talk about this morning. Community testing. Still lots of tests available out there. Home tests are ubiquitous. The other day, going to shopping for Valentine's Day gifts, happened to notice that all of the pharmacies have rapid tests that you can purchase and get a free N95, by the way. A lot of them are still distributing. And then you'll have the option of getting tested at one of the other community centers. For Wake Forest Baptist Health specifically, we have 3 free testing sites available. Here in Winston-Salem at Bowman Gray Stadium, Wilkesboro at the old airport, and then in High Point at Provincetown Mall. And those sites the dates are being extended through the first part of March. And so you'll be able to get a test with a rapid turnaround time, 24 hours or less at those places. So that's a great place to get tested, and then that way you don't have to wait in the waiting room in urgent care, and certainly don't want to be coming to the ED just to get the test. So still, testing will be out there and available. I wanted to bring up something else, and this also reflects another pandemic that people don't think about every day, and that's HIV and AIDS. We've been dealing with COVID pandemic for 2 years. We have been dealing with HIV and AIDS since 1981. So that's what, 40 years now? And we have been working on therapies for HIV and AIDS over the time frame, and now HIV and AIDS is now a disease that people can live with if they take their medicines largely, so it's become like something like diabetes. The ultimate cure for HIV and AIDS has been elusive. And a vaccine for HIV and AIDS has been elusive too. And we won't go into all the technical reasons why it's hard for that, but it has to do with when you get a virus that infects the immune cells itself, it's tough. But just this week announced a woman here in the United States who was cured of HIV and AIDS through a stem cell transplant. Now, a stem cell transplant's not the end-all answer for the treatment for HIV and AIDS for a lot of reasons. It's tough to do. It's risky in itself, but for people who need it for their cancer and they also have HIV and AIDS, we've been able to cure now probably 4 people, 3 that have been confirmed. So that means we've learned a lot. And we've learned maybe some approaches to the virus through this case and others that have taught us where to go and how to get at it. And so it's really a significant step for HIV and AIDS. So I'm an infectious disease doctor, so I can't forget about the other viruses, but that's a biggie, so if you saw that in the news. I'll open it up to questions. Colleagues in the media, Facebook colleagues.
So someone they hadn't gotten their J&J booster, they've only had 1 shot, and they got Omicron a couple weeks ago, so they're wondering, should they still get a booster, and if so, when?
Yeah, so if you got 1 J&J, you got Omicron a week ago or so, last month, let's say. And by the way, how do you know you've got Omicron and not another variant? If you developed COVID after the 29th of December or so here in the Triad, you had Omicron because there wasn't really anything else circulating. Do you need to still get boosted? I would still get boosted. It turns out that to get the full gamut of immunity to protect you from serious disease, which is hospitalizations or death, you kind of need 3 immunologic stimuluses. So you need two, you could do it different ways. You could have 2 vaccines and then get Omicron breakthrough infection, and that's kind of like getting 3 stimuli. Or you could get Omicron first and then get 2 vaccines afterwards, and that's 3 stimuli. So you want to add up to 3. Now, immunocompromised people, you need a 4th dose, at least as we know now. If you've had J&J though, and then you get Omicron, I'd at least get 1 messenger RNA booster, at least 1. If you want to get 2, that's fine, it won't hurt you, and just give you a little bit of an extra boost. And what do I mean by messenger RNA? That's either Moderna's or Pfizer's here in the U.S. So that's kind of the way to look at it, I think. Yeah, that's the answer to that question.
So if they got infected, do they need to wait like a week or 2 weeks?
Yeah, there's no specific time frame for how long you have to wait after having Omicron before you get a vaccine booster. You have to wait at least until you're out of isolation, which technically is 5 days, probably easier to wait 10. I wouldn't wait more than 90 days though, because that's all we have data for about how good Omicron natural infection is for providing immunity. So sometime between 10 days and 90 days. You got that time frame to get those boosters. I think will there be a fourth booster for us non-immunocompromised people? Probably not for a while. I doubt it. Maybe next fall, we'll have to see, but I don't think in the near future. Because those 3 immunologic stimuli really work well. It's still around 90% protective for hospitalization and death, so that's good. That's real good.
Do we have a parent saying their child has 2 pediatric doses of the COVID vaccine? Can they get a booster when they turn 12?
Yeah, so if you've had 2 pediatric doses of the vaccine, and here it's going to get a little bit complicated, but you'll be eligible for a booster roughly 5 months after those 2 pediatric doses. So if that's before the age of 12, you'll get a pediatric dose. If you turn 12 in that interim, then you'll get an adult dose, and which is okay. I wouldn't hem and haw about the differences between those. Let's say though, if you wait 6 months, you'll be 12 and get an adult dose rather than waiting 5 months. That's okay too, if you want to wait that extra time. I wouldn't put it off too long, but so that age 5 through 11 hasn't quite come up on booster time yet, because I think we didn't have the boosters. We didn't have the original shots available till then. What was it? The last part of November. So if you wait out 5 months, it hasn't gotten there yet. Getting close, but good question.
This person's asking, they're unvaccinated and their family's unvaccinated. Can they still meet indoors if they wear an N95?
So if you're unvaccinated and your family's still unvaccinated and you all want to get together, Mardi Gras, you want to have a Mardi Gras to get together, then yeah, if you wear an N95, you can do it. That's fine. That's good. I mean, unvaccinated people are kind of in that group of being vulnerable, actually. They may want to mask up. How many of them will, I don't know, but I'd recommend it.
So I just got a question, kind of along those same lines. So as mask mandates being lifted, would you recommend that maybe those under 5 who don't have the option of being vaccinated might want to continue masking?
So what about the under 5, since we now have to wait till April to get our under 5s vaccinated? Would I recommend them continuing to mask? You know, there's some ups and downs with that. You know, until our numbers really come down, probably. I mean, once they get down below 5 per 100,000 per day, then maybe it's not a big deal anymore. But, you know, the situations where you might want to think about it, daycare. Lots of viruses go around daycare. You know, other places where you might have your child in a kind of a crowded situation. Visiting grandparents who are over the age of 75, they may want a mask. That's to help with the grandparent. So those would all be things where you might think about it. I mean, it's interesting, kids under the age of 5 actually do pretty well masking, till you get down to the 2-year-old range. But so, yeah, I might. And, you know, then We don't have a lot of medical grade masks for that age group. Although I did notice this morning that DHHS, federal DHHS, says they're planning on distributing masks for small kids that are N95 equivalent. So that's good. Those, I don't know the time frame, but that was in the media this morning. So cloth masks, that the big thing is that it fits well and that it stays up over the nose. So.
We have someone who is 79 years old. They would like to go to the gym to do a group workout. Is that safe? What should they do to be safe there?
So if you're 79 years old and going to a group workout at the gym, I would assume you're in pretty good health. So, and if you've had 3 shots or the equivalent, yeah, I think it would be okay to go to the gym, because in the over 75 group, having the 2 vaccines plus a booster is still pretty good, as long as that you don't have a lot of underlying health problems. So I think it would be okay as our numbers come down. I don't want to wait a couple more weeks, but yeah. All right, so masks come off March 1 for all of the jurisdictions in the area that I'm aware of. We'll see what the school board's final vote is. And it's also Fat Tuesday, right? So you can take off your COVID mask, put on your Mardi Gras mask. So. We'll see you in 2 weeks. 2 weeks. Not meeting next week, 2 weeks.